I'm Amanda Marsh. I'm a Physio First member and currently on the Education Committee. And I've got the pleasure of interviewing Katherine Roberts, who's written a couple of articles for us in spring edition of In Touch journal. Kathy is an experienced physio specialising in occupational health and ergonomics, and she's worked in a variety of public, private and other sectors. She really enjoys being based and entrenched within an organisation, especially when she can really have a positive influence on health and safety culture. And she's a passionate educator, hence we asked her to be an author, and currently holds the position of Education Officer for ACPO. Thanks for talking to us, Kathy.
Thank you.
Your articles look great, by the way, but I wanted to just ask you about your own journey into why you got into occupational health and ergonomics.
Yeah, thank you very much for the invite, Amanda. I'll be very pleased to talk about my introduction to occupational health and ergonomics. I was working as an MSK physio in an outpatient department of a private hospital. They sent me to one of the local contracts, which just happened to be with Surrey Police. So I found that actually I really enjoyed the work within the occupational health department. So I went off and undertook a master's degree in health ergonomics locally to me. And that basically opened a lot of new doors for me. So eventually I set up my own practice. Initially, I had actual premises and worked within organisations. After a few years, I actually closed the clinic and carried on my rehabilitation within organisations. So now I'm working for myself, and I have a large number of customers that I do all types of different occupational health and ergonomics work. Some of it is very small amounts of work, and others I will go there, say once a week, for example. But that's where I currently sit.
Brilliant. So can any sort of jobbing musculoskeletal physio assess occupational health and ergonomics? You've obviously got a master's. Where's the scope of practice boundaries sit?
Yeah, well, as you might expect, you need to be competent in the area that you're working in. And sometimes you actually just need to know what you don't know, because otherwise you can potentially be dangerous. However, in musculoskeletal practice, it is really important that physios talk about work and health. Now, work and health is occupational health. However, these questions aren't being asked, I don't think, enough in the population group of physios. So anybody working with adults of working age should potentially be having more of an input and having these work conversations. And we're all skilled at that. We have the ability to do that, but they're not being undertaken quite enough in depth. We need to find out more about the work demands and break them down, not just into job titles, but into the specific tasks that people undertake, so we can aim our assessment and our treatment programs to those particular tasks that the individual needs to undertake. So that's work and health. I think with the introduction of first contact practitioners in primary care and advanced practitioners in private practice, I think also there's more scope there to get involved with having these work conversations and potentially taking it further to influence what's going on within an organisation. So, for example, empowering the patient to question and discuss their work factors with their employer, I think is something that most physiotherapists will be competent to undertake, and perhaps actually undertaking the AHP work and health reports as a means of communication, a tool to help support that employer and the employee to get to grips with what needs to happen within the workplace. I would put the caveat on that, though, that if you're out external to the organisation, you need to be very realistic with what you're recommending. So it needs to be very clear, very simple, and generally more behaviour-based than equipment-based. What we don't want to see is a lot of equipment being recommended by physios or other healthcare practitioners that then is not feasible for whatever reason, maybe cost or logistics, or it may actually not be the right piece of equipment. So that there is you have to be careful you're working within your scope, but I think there's a lot of ways that you can up your skills, and we'll talk about those a little bit more. But you definitely have a place to discuss work and health and should be doing so.
So keeping it clear and simple, how would an everyday jobbing physio build questions into their assessment?
Okay, so there's a number of questions that we would like to ask, and generally having that work conversation involves asking the individual employee or patient what they feel is actually the problem regarding work. Now that sounds very simplistic, but we get so much information that's valuable to us from the individual employee. They're the person working there. They know what the difficulties are, and often they also actually know what the potential solution might be as well. So just repeatedly drilling into those questions. So, what is it at work that you're experiencing difficulties with? Can you explain the roles that you undertake so I understand more fully? Questions like that are extremely useful to open up that work conversation. And there are tools that you can use to help with that. For example, there's a shared decision-making tool from Cardiff University that is a very valuable tool to help you have those work conversations.
Great. One of the articles talks quite a lot about the use of flags, and we're probably very au fait with sort of the red and yellow flags in the system. Can you talk about how useful you find the other colours of the flags?
Well, the other colours, blue flags in particular, the individual's perception of their organisation of work. So how the individual may perceive their relationship with their line manager, or how the individual may perceive their workload. They may perceive that their work demands are too great for them in their current state of health, for example. They are absolutely crucial with our work in occupational health. We have to understand these obstacles because if we don't understand them, we can't influence them, and they're so powerful to our questioning, as are black flags, which are more the organisational or contextual flags. It tends to be slightly more difficult to influence black flags. However, if you are an individual working within an organisation over time, you actually can influence things like policy and organisational culture, for example. But if you're an outpatient physiotherapist, that's going to be much more difficult. However, you need to identify those obstacles, because then you can clarify the situation and understand it more fully. So yes, I would say absolutely crucial, and tools that we use an awful lot to understand these barriers. They fit into a biopsychosocial model of health. We have to ask these questions.
Yeah. There are, talking about flags, there are so many screening tools, outcome measures, assessment tools. How do you know what to choose?
Okay, yes, with difficulty sometimes. There's so many there. I think it comes down to your assessment skills, particularly your subjective assessment skills, of drilling into the right areas for that individual person. So with musculoskeletal complaints, we need to understand, what might be the obstacles, how much mental health issues may perhaps actually be part of the whole problem. From a work factors, with these tools, we often use the Aribo or the Start Back tools, because they give us very quickly some very powerful information about that individual at work. But it comes with practice and skill, but I would say that you don't always get it right from the start. You learn from that. And I would say that often within an occupational health setting, we tend to have longer than perhaps you do within more of an outpatient setting. And we're more likely to use 2 or 3 outcome measures or screening tools, for example. And would you use that as evidence in addition to our more objective functional measurement tests that we'd also use to help draw in more information, and then use that for comparisons perhaps later on? So yeah, good question. I'm not sure if I've answered it adequately, but with experience and understanding the occupational health setting more, which again comes back to your question before of understanding, where your competency lies.
Yeah.
To be competent in practice in occupational health, you need to know more about the specific tools that you can use to aid your assessment that may be different, maybe more functional, maybe more work related, and that will include things like outcome measures, for example.
And that probably actually brings me on to my next question about in your role as education officer for ACPO. What what can you offer as a sort of a taster to get people started in occupational health and in this area of specialism?
Okay, so we're thrilled to be collaborating with you. That's absolutely fantastic. And we, as a professional network, we have put together a work and health learning and development tool. The main part of this resource is for ACPO members, but we have enabled guest access as well, which is free to anybody. You just press the big yellow button that says guest access. And within that, there is a lot of resources that are useful to you. And module 1 of our course, which is Occupational Health Essentials, which is very much an introductory course. So module 1 is free to you, and it's very useful just to sort of set the scene a little bit more, understand a little bit more fully about what working in occupational health might mean to you. But also there are other resources there too. So I'd really advise you go there. In addition, on the CSP website, in their Learning and Development Hub, there is a training, a presentation on use of the AHP Health and Work Reports that I think is very useful to you. And I think you're well placed to kind of put your toe into the water to sort of find out whether that is an area that perhaps you might want to go forward in. And I would say your background probably puts you in a great position to move forward into that direction if that's what you want to do.
Our members do love something for free as well, so module 1 sounds fantastic.
Always goes down well.
Our Physio First members can become quality assured practitioners through taking part in, we have a data for impact scheme, and we're really looking about demonstrating measurable, validated sort of quality treatment. So looking at the articles, what do you hope our readers will take away from them?
Okay, so I would hope they get a sort of a feel for the complexity of occupational health and ergonomic work. There's lots of different work environments that we go into. It's not just office ergonomics and DSE. So to acknowledge that and to understand that actually there's a lot of potential work opportunities there in very interesting environments. But assessing work and health, if you're working with an individual that's of working age, are you talking about work enough? So introducing that into your assessment is just so powerful and influential to your outcomes. Becoming familiar and using the AHP Health and Work Report as a tool. We're very much supported as physios to use this tool. And I think if we don't start using it, it's basically a footnote that can be used with the same authority as the Med3 GP footnotes. And I think we need to start using it. We need to show our skills. We are so well placed to actually do this. And I think if we don't, other professional groups will get in there and do it. We need to prove in bulk really that we have the skills to do this. So become familiar with the AHP Health and Work Report, and there are training, we offer some training to that, and there's training with a lot of the universities for FCPs and APs, for example, as well. So get to grips with that. The use of functional measurement tests, I think, as well, is something that aids objectivity with function and work. So it may not be appropriate to use the more complicated ones, but it may be that introducing functional measurement tests into your outpatient settings might be useful. But I think for me, it's giving you an idea of what an enjoyable and new place of work this can be. It takes you out of a clinical or hospital setting into work settings, which is different, and it opens up doors for different types of work to be undertaken, which I would certainly say has worked really well for me. I found it really enjoyable. So I think there's areas and avenues that you could explore to open up your work opportunities.
Brilliant. Kathy, thanks so much. It has been brilliant collaborating with you, and we were sort of discussing that sort of first of all, that it's what we all need to be doing more of. The collaboration is where we really kind of push the whole profession forward.
Absolutely, and I totally agree that it's great to get the two professional networks talking and supporting each other, and hopefully that's how we will move forward as well in the future and learn from each other.
Brilliant. Careful what you say, though, because it just means we'll come knocking at your door again to do more
Yeah, well,
articles or
likewise.
education.
We'll do the same. So we expect an article from you guys very soon.
All right. Thanks so much for your time today.
You're most welcome, Amanda.
And I'm just going to plug your article again and say, if you haven't read, so Spring in Touch, pick it up, have a look at the articles. They start from about page 3. Really, really interesting read. Thank you so much, Kathy.
Get in touch with us, ACPO, if you have any questions. We're most agreeable to having chats with you. And if you want to discuss membership, that's fantastic too.
Thanks, Kathy.